Well, there's a well-known quote. You can have all the riches and success in the world, but if you don't have your health, you have nothing. Now, survey responses in my community would show that health is the most important issue to us. More than 5,000 people have responded to my survey over my time as the member for Mayo in this parliament, and health is our #1 priority. And I have repeatedly campaigned for greater access to affordable health care in Mayo. I've worked with the community to secure expanded headspace mental health centres for our young people, a Medicare rebate eligible MRI service, 24-hour doctor service at our Mount Barker Hospital, and a Medicare service counter at Victor Harbour. I've had many successes, but it is the lack of renal dialysis service in the Adelaide Hills that was a problem that I was determined to resolve. The lack of dialysis services had a profound impact on the families in my electorate who grapple with the physical and emotional and financial burden of travelling to and from metropolitan dialysis services, many of whom are not eligible for the Patient Assistant Transport Scheme. However, today, Country Health has finally recognised the urgent need for a renal dialysis service in the Adelaide Hills, something I've campaigned on for over 2 years. Country Health will shortly place 3 dialysis chairs at the Mount Barker District Soldiers Memorial Hospital, which will be co-located within the chemotherapy unit. Up to 12 patients will now be able to access dialysis service, saving these patients and their families at least 1,872 trips to Adelaide each and every year. This is just fantastic news for our community and will make a very real difference to those families. However, we cannot rest. We always need to make sure we future-proof our health services, and the next priority is to upgrade the Mount Barker Hospital Emergency Department. Local health professionals tell me that the emergency department is fast approaching the end of its life and will simply not be fit for purpose within 12 months, with the limited physical space already impacting on service delivery. For example, there are not enough consulting rooms, the resuscitation room is too small, and the number of beds in the department should be doubled. The population of Mount Barker is currently 36,000 and is set to grow to over 56,000 by 2036, not far away for such a significant increase. With hospitals in our outer regions, such as Mount Pleasant and Strathalbyn, reducing their emergency services, the pressure on Mount Barker Hospital is immense and will only continue to grow as more and more people are forced to travel from the smaller satellite towns. Providing health services to our region will often come at a disproportionately high financial cost due to smaller populations, but this should not justify the removal, reduction or refusal of essential services to those living outside of the metropolitan area. Rural health matters. And that is why, earlier this month, I wrote to the State Health Minister, the Honourable Stephen Wade, to request that essential upgrades to the Mount Barker Hospital Emergency Department be listed as a priority project, and one certainly worthy of the federal government's $1.25 billion investment into the regional hospital infrastructure through the federal government Community Health and Hospital Program. The upgrade of the Mount Barker Hospital Emergency Department already forms part of SA Health's 10-year local health plan for the Adelaide Hills between 2011 and 2020 and has the full support of the Mount Barker District Council. And I won't stop there. I will continue to campaign for a Medicare rebatable eligible MRI licence in Victor Harbour and an increased number of ambulances to service our communities. And I will say, Mr Speaker, going hand in hand with health services are aged care services, and we need to make sure that Mayo, as the community, the oldest electorate in South Australia, has enough aged care services, both residential beds and care in the home. As I said, we need to plan for our future. So I will continue to fight to make sure our health services are able to meet the growing demand, the growing need, and that they are fit for purpose, and they are able that they enable our medical professionals to deliver the highest possible standard of care to our community now and into the future.